but he will just join as soon as, I mean, in a very, very few minutes.
Sure.
Ma'am, Tilakeswari.
Yeah. So, Professor Santosh has not joined us as of now, is it?
Yeah, he just messaged me, so he's joining in very soon.
Okay. A very good morning to all. We welcome you all
Good morning.
to this one-day launch event of the COVID Academy uh, in Manipur. At the outset, we wish to thank a diverse panel of members who have joined us this morning. Uh, we wish to thank Professor Santosh Kumar, who has not joined us as of now, but will be joining us in a while. Uh, mm, from NIDM. So we also wish to take this opportunity to thank Mr. Ranjit Kumar from the Relief and Disaster Management Department, Manipur, who has been always very cooperative, supportive in terms of having this collaboration put into place for launching this COVID Academy in the state of Manipur. Thank you so much, Ranjit sir. We also wish to thank a panel of other experts like Dr. Prem Chandra, the Deputy Director from the Public Health Department, Directorate of Health Services. We welcome you, Dr. Prem Chandra, to this event. We are also joined by Dr. Tilkeshwari Devi, who's the State Nodal Officer from the Health Department. Also, Dr. Uthan Taurujim was the Senior Resident Jenims. Dr. Grena, who's a public health specialist from the Directorate of Health Services. We are also been joined by our WHO and UNICEF colleagues. Dr. Ashish Dadwal is with us. Dr. Maulik Shah had to attend a very important meeting, so he could not join us. So Dr. Ashish Dadwal, who has been a part of our other state initiatives in other parts, is also here with us from UNICEF. We are also joined by Dr. Apau, who's a surveillance medical officer from WHO. I hope all the speakers are here, but we'd also like to have a special mention of Father Biju Lokos, who is the IAG convener in Manipur and the director diocese. So we welcome you, Father Biju, for this for being a part of this meeting today. Also been joined by Kisam Pradeep Kumar, who is the Secretary Social Upliftment Department. So thank you so much, sir, for being a part of today's session. So before we actually start the session, we would like to take you through the no through some of the objectives and to tell you more about the coalition. So Spare India is a coalition of humanitarian agencies which has been actively mobilizing agencies across India to contribute to COVID-19 preparedness. Spare India activated the multi-stakeholder coordination platforms at state and district levels in India, seeking to promote and facilitate coordination and collaboration among many actors and agencies and local partners on COVID preparedness and response. With its outreach network of 72 nodal agencies and 702 local partner agencies across districts all over India, we've had the experience that started as a collaboration with many organizations, and in a period of time, this COVID-19 Academy has reached many people. So in the phase one, we've completed almost 100 sessions, and in phase two, we have this endeavor to reach to more than 1 lakh people. And this academy has been instrumental to build capacities of frontline workers, PRI members, volunteers, and others since its inception. So today, the Manipur COVID Academy will emphasize on reaching a similar range of people to help us in the containment of COVID-19. And the COVID Academy will also aim to provide a collective platform for frontline volunteers, PRIs, civil society organizations, faith-based organizations, community-based organizations, corporations, Red Cross, civil defense, and other technical people who are working in the respective fields for a resilient preparedness and response effort to COVID-19 related disasters through a series of online trainings which will be hosted on the COVID awareness prevention. So largely looking at the objectives of today's workshop, today's launch event, the broad objectives would be to develop scientific and technical knowledge and understanding about COVID-19, to facilitate one-to-one interactions with the experts on COVID-19, to enhance the capacity of the frontline workers and volunteers in the delivery of COVID-19 care services, and to build support community-led COVID-19 containment initiatives, to enhance enabling environment to cope and live with COVID-19 through right information on this pandemic, and to share best practices in the containment of COVID-19 across the world. So, with some new things coming up, we would also like to take this opportunity to discuss about this COVID vaccine rollout. Now, this vaccine eagerness and hesitancy, and reaching out to people with concerns with the vaccine and ensuring efficacy of the same. So, under this COVID academy, we would also like to discuss a range of sessions which would give us more information and insights into what are the do's and don'ts, more information on the communication strategy that has been rolled out by the government of India, what should be the role of CSOs and NGOs, and Niti Aayog has recently conducted a meeting with CSOs and CPOs on the role of community awareness, flagging misinformation, planning along with implementation, and addressing vaccine eagerness and hesitancy, which continue to be some of the key concerns where CSOs can play a major role in complementing and supplementing the government efforts. So, under the COVID Academy session, while we are looking at some of the structured sessions, we are also looking at sensitization on COVID vaccine rollout. The dry runs have been done in certain states, of which our WHO and UNICEF colleagues will give us more information. But it is our endeavor to include the CSOs, the frontline workers, in the entire scheme of interventions and complementarities with the state, district, and block administration, to work closely with them. And this is our exercise, and this is why we have launched this, to sensitize more and more people, to make more and more people aware. And we can have a lot of these dissemination material by the government of India on the Ministry of Health and Family Welfare. We have a lot of material online in place, which we can reach out to these frontline workers in terms of making them more aware about these guidelines and these what should be the role which is emerging. So, I would stop here. I would give more details during the course of the sessions after we've heard some of the speakers here. So, Chantoy, is Professor Santosh joined us?
Not yet, Hena. She's just texting me the message that she's joining very soon.
Okay. So what we'll do is that we will start with the first presentation, and you can introduce the speaker and we can have the first presentation, please.
Okay, thank you, Hena. So now, as we are still waiting for Professor Santos, so I would like to hand over. I would like to request Sir Ranjit Akoizam Ranjit Kumar, who is the documentation cum research officer in Disaster and Relief Department of Manipur, and also Ranjit sir is being very kind person from this state of government of Manipur side, who is being helping us, who is helping me personally to make out this program, the launch of COVID-19 Academy successful. So I would like to welcome Ranjit sir and give some any from your idea and whatever you would like to share with us on COVID-19 Academy. I would like to welcome Ranjit sir.
Hello. Hello, am I audible? Hello?
Yes, sir, you are audible.
Good morning to all. Some, I welcome all the participants in this video conference of COVID-19 launching program. Some time back, we have started some sort of a kickoff meetings, and this time, such academy of COVID-19 will be very useful, particularly the stakeholders, social workers, and related other departments. So, I'm a bit tight with other administration work. I don't want to speak for a long time, and please carry on. Thank you. Hello, hello.
Yes, sir.
Uh, Let other speaker starts.
Okay. Thank you, sir. Now I would like to very good morning, Professor Santosh Kumar, sir.
Very good morning.
Good morning, sir. Good morning.
Good morning to everyone.
Sir, I would like to take the opportunity to introduce Santosh Kumar, sir, who is the who was the former director of SAC, also Disaster Management Department, and now um, he is working as a professor in National Institute of Disaster Management of India, and he had been working with many other organizations in collaboration with UN and other multilateral and bilateral organizations also. And he is a very eminent person, and very we are very fortunate to have you, sir, in this COVID-19 Academy launch. And now I would like to give this for you to address us. Thank you, sir.
Sir, we are not able to hear you. Unmuted yourself. There's some issues with the mic, is it, Chantoy?
I don't know. Let me just confirm with Santosh,
Sir,
sir.
we are not able to hear you.
Yes.
Can I have my session now?
You will send me off now after that.
Yes, sir. Sir, you may kindly
Professor
start.
Santosh? Professor Santosh? There is some issues with the mic, I think.
Can you hear me?
Yes,
Yeah.
sir. Now loud and clear.
Okay. So voice is there clear?
Yes, sir.
I could not hear what were the deliberations earlier.
So deliberation has just started. Only just Hannah have given the objectives of Scale India and this COVID-19, and now you are going to be the second speaker.
So, I've briefly taken the audience through some of the core objectives of launching the COVID Academy in the state of Manipur, and which is largely to do with developing the scientific and technical knowledge and understanding about COVID 19 and facilitating one-to-one interactions with the experts. And these trainings are basically for the frontline workers and volunteers, the PRI members, the civil defense, Red Cross, the health workers who are working in the peripheries, providing all sorts of support. Many a times they do a lot of efforts, but then because of the lack of information, they're not able to kind of know adhere to the guidelines, or there are so many of them. So to enhance enabling environment to cope and live with this COVID through right information is how and why we've established and opened these vernacular channels at the state levels. And we welcome you to this launch event, sir. And this is also to share best practices in the containment zone. So I was also taking the audience through some of the things that have happened in terms of the vaccine rollout. So we have a set of structured no academy sessions which we usually roll out in all the states. But with this vaccine rollout and this vaccine eagerness and hesitancy, we have a lot of guidelines coming in from the Ministry of Health and Family Welfare, which need to seep in and go to our peripheral pockets now, to those frontline workers. So a lot of our efforts would also go in providing and sensitizing those frontline workers on those issues also of vaccine rollout, of what are the key concerns in terms of vaccine hesitancy, and to allay their doubts and their fears and apprehension. And Niti Aayog recently conducted a meeting with CSOs and CBOs on the role of community awareness, flagging misinformation, planning along with implementation, and addressing vaccine eagerness and hesitancy, which were some of the core concerns which we have recently, SPARE has recently taken up in their health committee meeting, and with some of the technical experts on health with WHO and UNICEF spearheading that. And we are also looking at defining the role of CSOs, NGOs, CBOs, FBOs in complementing and supplementing the efforts of the government in putting out the this vaccine launch that is there. And so they have a very critical role to play for the rollout process. And I see that there are certain iterations still happening in the document which has been prepared by the Government of India. So I think more clarity will come by the end of this week on the circulation and examining of the resource materials available. So this COVID Academy will also become a platform whereby we share those guidelines and that information with the participants and with the frontline workers who will be a part of these COVID Academy sessions. Thank you so much, sir. Over from my side.
Thank you. Do I need to intervene now?
Yes, sir.
Yes, sir. Please go ahead.
Should I speak now?
Right, sir.
Are you able to hear, listen to
Yes,
me?
sir. It's loud and clear.
Hello, am I audible?
Yes, sir, you are audible. You can go ahead. Please go ahead, sir.
I'm not able. I'm not audible.
You are audible, sir. Can you hear us? We are
Yes, yes,
able to hear you. Yeah.
yes. Can I start now?
Sir, please start.
Okay, thank you very much. First of all, let me congratulate the government of Manipur for taking this initiative, and also the people who are engaged and who are actually organizing this program with the Sphere and NIDM and all the partners, ILO, IOM, then Public Health Foundation India, and all other partners who are participating with this initiative, including UN Women and also UNFPA. So important is that when we are at this stage, when we are talking about COVID-19 Academy and the COVID-19 management, initially we had one problem, that was COVID-19, and we had to manage this COVID-19 victims. And the way it was spreading, so we had the lockdown. So we went for started its function almost on a full strength. And now the problem is two more. One is this COVID-19, which is coming since February, and we are grappling with. The second is now we are talking about that the new mutation which is happening, another virus which has come from this London or UK, you can say. So this is another mutation which was also found in India. Third is now that we have to plan for distribution of vaccine. So availability of vaccine and how that vaccine management continues for us. Who should be given, who should not be given, who should be given first, who should be given second, who should be given third. That protocol is being led down by the ICMR and also Government of India, along with the discussion with the state government. Then the moment we talk about, let's go from the vaccine distribution. And another issue is also in the pipeline that whether the global community has stopped thinking about the treatment of COVID-19 or just banking on the vaccine distribution. And vaccine is the only hope, or that it will combine with the treatment. So one fear which is there, that because of the new mutation, that large number of patients likely to get affected. This is one fear. And if it is not controlled, that probably that healthcare system would be overloaded just with the new virus, because it has a larger spread than the COVID-19. And the second is that although it is not that fatal as it was COVID-19, but the spread is very fast of this the new mutations. So we collectively, if we think 3 or 4 issues, that how these 3-4 issues are going to get affected by our own system, and whether our system is geared up for addressing all those issues together. So one, then we said that let us start with the vaccine, receiving vaccine, and the training people that how we can go ahead in the large number of vaccination. If we get suppose we get 1 lakh, any state get 1 lakh or 10 lakh or 1 crore of vaccine. How this 1 crore of vaccine could be actually, people could be vaccinated in a 3 days of time or 4 days of time. What is our health, this personal capacity, the doctors, the health workers, the nurses, how they are trained and how they are undertaking this. So just getting vaccine is not enough, but the storage of vaccine is another challenge. Transportation of vaccine from, suppose you get this into the capital of the state, and then you have to take far off from the capital. Then how you are going to transport it, where you will be keeping. So these issues to be worked out. That's what Honorable Prime Minister is also hammering again and again in his meetings, that how we should gear up. And if you see that we have 3 types of vaccine available, and those one that we are talking Moderna, and the other we are talking about Sputnik, and then we are talking about Pfizer. And we do not know at this stage that which one the state would be getting, whether they will get Pfizer. Pfizer has a different requirement. If they mixed of the Pfizer and the Moderna, there are 2 different kinds of a requirement. Say that Pfizer requires minus 70 degree or freezing cold, minus 70 degree kind of a storage and transportation system. Whereas that we see that Moderna requires a minus 10 degree kind of a, so that requires different kind of a preparedness and the logistics. And when we talk about Sputnik, and another is the Bharat produced by country, Bharat Chemicals or something like that. And if that is there, then they have a different requirement. Still, Bharat is going on to the 3rd stage of kind of a vaccine testing. But at all, if all these kind of protocols are completed, and then depends on that, suppose you get 10 lakhs or 100,000 kind of vaccines, then you will have to find out whether it's a mix of vaccine or it's only one type of vaccine or other kind of a vaccine. And you have a population, say, to be given, say, old age people, health workers. First line is the health line workers which we are giving, or that administrator, you decide whatever the protocol comes as a final one, that who should be given first. The children and the people who are 60 plus, they should be identified and all. But the idea is to that identification and database system should be ready. How you are going to locate those people who are where, and how the communication would be there. Are they registering online whether the online registration process has begun in the state, whether they are giving all their GPS kind of a location where things can be done, whether they have to report to the clinic, what time is to be given. So it should not happen. We draw lessons from that kind of a testing. When we were doing testing of COVID-19, initially we had a hue and cry for testing. Thousands of people were getting collected at one place, and then it was very difficult to manage those crowd, that whom to test first and whom to test second. So this kind of a challenge would definitely emerge as the supply demand deficit would be there, and one dose, and when the second dose would be there, and how we are announcing that those who are taking the dose one on X date, what would be the proper date for the duration where the second dose would be given. So these kind of a meticulous planning are required in the vaccine dissemination and also actual operationalizing the vaccine. Second thing would also emerge while during giving this vaccine. If somebody dies with some different reason, not because of the vaccine, but the trust deficit would emerge and the rumor will go very high that somebody X took the vaccine and the person has died. And we will not be able to, and the rumor spread very faster. The local media and other media will have different views on that. As we were seeing in some of the things happened in Madhya Pradesh, a person who volunteered for vaccine testing and he died. And entire country is talking about that vaccine is not good and person who are taking, they are dying. So, and the reasons were not explained if in early, then you don't have time to go for kind of rectifying what has been already spreading amongst the community. So the quick mechanism to identify such cases and come out with the community that X, Y, or Z, that is important. These are the all management issues. And when we are dealing with large number of people, that's what I'm giving you the number. Totally, in the world that global community have assessed that in 2021, they will be having 5 billion vaccines. So 5 billion vaccines, meaning thereby 2.5 people would be given vaccinated, because each 5 billion means two doses to one person. So in the 2021, only 2.5 billion people of the globe would be able to get those vaccines. So importantly, when 2.5, the 7 almost 6.5 billion people are not accessing vaccine in 2021. So this would pose the challenge that whatever your requirement, you will not get that kind of adequate vaccine number. So you have to manage within that. So how you are managing and how you are having confidence of the people, what kind of a mechanism of communication you have drawn with the people, so that people have the confidence in the governance and also people have the confidence in the delivery system. Because anything goes wrong, that is spread very fast. So this is the kind of which we are saying that one, that what type of vaccine you are getting, what kind of a, if you're getting the mixed type of vaccine, that mixed kind of a logistics for transportation and the storage has to be done. Mixed kind of a protocol is to be done for the giving of the vaccine. How many human resource you have available who can actually execute this vaccine giving in vaccination process. So supply demand. Again, I would suggest if you are finding it difficult, maybe in many of the countries they are trying, like I'll give you the example of Israel, and which already have vaccinated 16% of the total population, whereas this France and others, they are not even able to cover 1% of the population of vaccination. But they are going fast, meaning thereby they are trying different methods. And those methods are they are trying to do the vaccination in the night time also. They are gearing up the system for working beyond the 9 to 5 kind of order. So multiplying the people, those who are not there, they are utilizing those people who have retired, and they can be brought in the system for vaccine dissemination. So we have to think out of the box and in the management and delivery, and also if any rumor or if any failed cases, we have to capitalize that. And the last but not the least, which I would mention the point in terms of the pressure on the healthcare system. If the mutation still goes faster, even if the mortality rate is not higher, that it will decapacitate the hospital also. The other the mutation which is taking up with the COVID-19 and another vaccine. So these to be kept in mind, that how hospital facilities are up to mark and gear up to accommodate if that explosion of the patients happens. So that is the case which I wanted to highlight. And if you get some medicine also for treating this COVID-19, the global community, they are trying in London, they have tried out, and it is very, very in reducing 30% of the mortality. That is, they're using arthritis, this medicine. It is tested and announced. So those kind of information system which we have to gear up, and we have to see that how ICMR is guiding us, and always constantly look at that the directions from ICMR, directions from the WHO, direction from the legitimate authorities. That will help you in terms of this entire management of COVID-19. So I would say this much, and I would stop here, and thank you very much for giving me this opportunity. And last but not the least, one point I would flag, as this Northeast and our countries also prone to other disasters. So how we are also equally, our governance is equipped with handling other disasters if we might face, God forbid, but if we might face during this all vaccination process. Just we need to have this kind of in the planning system. Thank you very much for giving me this opportunity.
Thank you so much, sir, for this very insightful session. You've taken us through the threats and risks with this new strain of vaccine that is coming in. Thank you so much for helping us through understanding what are the implications and what are the vulnerabilities also with Northeast, as you've rightly said, falling in multi-hazard prone also. You have also taken us through the some of the details of what are the different types of vaccines that are there, and which ones does the government of India kind of right now they're in the testing phase, and what are the protocols, how are we ensuring that different range of people are getting are falling under the coverage of this, and how many of them can actually do that in the first round. And you've also taken us through the meticulous operational planning, and you've also taken us through some of the different strategies which we can employ. So very important point is on this risk communication and community engagement, which would be our large focus during the setting up of this COVID Academy, in which because frontline volunteers and workers have a very critical role in understanding the risk management. And I mean, this is a new vaccine, and there are many misinhibitions in people's minds also. So that would largely be covered during those exercises on sensitization and awareness through the medium of the COVID Academy, sir. And as you've rightly said, there's a lot of pressure on the healthcare system also, which we need to kind of then see how we are managing and how we are building on that. Thank you so much, sir. It was a very, very insightful session. Thank you so much once again.
Thank you very much. Thank you.
Okay. Next, I would like to request Dr. Ashish Dawar, who is a health specialist from Northeast States UNICEF Executive Assam, and we are very much thankful to Dr. Ashish for joining us uh, in place of Dr. Maulik, as Dr. Maulik had to go for some other important work, and in a very short period of time, Dr. Ashish was agreed to join the session and to give the session. Thank you very much and welcome Dr. Ashish Dawar to give the session.
Thank you, ma'am, for inviting me here. I hope I'm audible.
Yes, yes, you are audible.
Good afternoon and happy new year to everyone. COVID-19 has actually taken everyone by a surprise. Last year was quite drastic in the events which came in form of COVID-19. The whole system, we experienced a whole systematic shutdown of most of the most of the facilities, most of the not health facilities, not just health facilities, but institutions, educational institutions, most of the emergency services were shut down, and it was overwhelmed. The system was actually overwhelmed. We didn't know how to respond. As UNICEF, as WHO, and as the government counterparts, we undertook a few credible things for system strengthening. First of all was awareness generation. As Mr. Ranjit Singh rightly pointed out, that the systems were overwhelmed, and due to that, systematically, to prevent the system from failure, actually, the capacity building of frontline workers and the capacity building of the doctors and the nurses, as well as improving the service generation of by the people was very much focused upon by UNICEF and by partners. This year, we are seeing from 16th of January, the vaccine is going to be introduced. As rightly pointed out, there are 2 or 3 different kinds of vaccines which are fourth runners. Our systems, our health systems, whether it be Manipur or any other state, are completely prepared to take on these systems, to take on the vaccine delivery and vaccine propagation till the grassroots level. Vaccines will be adequate. By and by, it will be a phase-wise manner, I think. The vaccination is going to be phased. In the first phase, the health workers are going to get the vaccines. So Manipur, I guess, is going to get around 150,000 doses in the beginning of the vaccine, and that was the number which was decided as per the health number of healthcare workers, the ashas, the frontline workers, who will be vaccinated in the first go, and then later on, for the general public, the vaccination drive is going to be there. uh, the misinformation part needs to be focused upon. We as UNICEF are constantly monitoring the situation along with our C4D communication for development, as well as media colleagues. We focus on proper dissemination of news rather than falsification of news. So false news is something that vaccine might not be that good, or vaccine might not work, or vaccine might cause a few things. These are the major challenges. This is a new vaccine. This is a new virus as such, and the vaccine is very new. So many people are going to say many things about this. Sir rightly pointed out what happened in just recently. One person who was administered the vaccine, he passed away, but that was due to underlying conditions. It was not because of the vaccine. So misinformation has to be dealt with. Misinformation in any form, misinformation for misinformation against the vaccine as well as against the service delivery and service providers needs to be focused upon, and that is actually a state initiative. We as partners generally help the state in dissemination and in generation in generation of material which can be disseminated by the state, the rightful maybe academic material, or maybe just for newspaper print media. Some information can be we focus upon some information which can be disseminated to the people at large, but we cannot generate all the information at all the time. We cannot give 100% of the information through the print media or through the news. For that, awareness campaigns are there, and we need to focus upon those awareness campaigns so that properly the rightful information is disseminated to the people. You see, 5 fingers are never equal, and people will always have doubts regarding every single thing. And since this virus is new and the vaccine is new, misinformation will be there. To curtail this misinformation, Government of India has taken very good steps. The state government of Manipur, as well as the state government of the respective northeastern states, are pretty proactively working towards curbing this misinformation. We are working with the state governments to improve demand generation also. demand generation of services, demand generation of demand and continuity of services during COVID-19. So demand generation actually took a very big hit when of services actually took a very big hit um, during the COVID-19 pandemic. As now we are struggling to cope back to normalcy, the major challenge is not just COVID-19; it is routine immunization as well, which needs to be focused upon. Routine immunization took a big hit. Routine immunization in Manipur was low in itself. It was around 60%, 58.9% complete routine immunization of children, which further went down during COVID pandemic. So this needs to be focused upon along with the COVID-19 pandemic, COVID-19 vaccine introduction. So side by side, as healthcare providers, as government functionaries, we need to focus upon a multitudinal thing or a multitudinal problem solving thing, and not just look into COVID-19 as an isolated part. The thing is that strengthening of RM and CHA interventions as well as immunization, along with the help of partners, would be very important in terms of not just curbing COVID-19, but also strengthening the response, the immune response, which might have depleted due to non-vaccination of children. Children are not being given zero doses of polio in the hospital. The number of hospital deliveries, if we see, we had a comparative study, and number of hospital deliveries during this pandemic time have actually gone down. This is something which our system needs to focus upon, that during pandemic, during any disaster as such, service continuity should not get hampered. Service continuity should go along as it was. For that, we need to train a different cadre of doctors, maybe privately engage a few doctors. We should have specialized doctors in place who are well prepared and well equipped to fight any kind of an emergency, whether it be COVID-19 or whether it be a natural disaster. Earthquakes, floods are very common in Northeast. In Manipur, faces a lot of crisis in terms of landslides in a few areas. The hilly regions of Manipur, they face landslides. Earthquakes are quite prone. Then disasters come in the form of disruption of services, which need to be focused upon again. So during COVID-19 vaccination, what our focus should be is continuity of RMNCHA services as well as continuity of COVID-19 vaccination. So initially, the vaccination would be just focused upon the frontline workers. But in the longer run, when the vaccination trickles down, the COVID-19 vaccination trickles down, at that time also, we should not forget we should not forget the other vaccines. Polio, for example, right now the NID has been postponed, but NID is going to happen. And when it does happen, we should not lose our focus. That COVID-19 पे focus raha, and then we forget polio or we forget MMR. We should not forget any vaccine because of COVID-19. It is a multi-sectoral and a multiple branched approach which needs to be taken into consideration. We cannot just focus on one part and forget the other parts. The approach is always holistic. Uh, the regional consultation of disaster preparedness had happened recently in 2018, had happened in Sikkim. Manipur was a part of that. At that time, COVID was not there. So again, we are proposing another disaster preparedness workshop for the northeastern region. I think it has been proposed this year. So it depends on how how the respective state governments carry it forward. But this year again, when we have it, we'll have it somewhere in Manipur only, in Manipur or in Nagaland, wherever the space permits and time permits us to have that. So we will be focusing upon the preparedness part of upcoming viral diseases, of rather than just being focused upon the disruption of services due to landslides, terrorism, earthquakes, flooding. We will be more focused upon the viral part of it. We had never taken into consideration the viral part, that nature can strike us in the form of virus. We were always thinking that disaster can be a part of a natural disaster, say uh, a flood or an earthquake or a landslide or on a larger level. But we had never taken into consideration a virus, a small virus which is zero point zero 0.01 micron size, and it has brought the whole world to its knees. We never took that into consideration. So now even our outlook towards preparedness, towards disease preparedness, as well as towards the resilience, the disease resilience or system resilience rather, has changed. And whenever we hold a workshop now, we will be more focused upon these aspects of the viral mechanism, the viral uh, what to say, the viral resilience as well, and not just the natural disaster resilience. So this is one thing. Secondly, and most importantly, I would really thank Sphere India for bringing along all all the people from different divisions, from different parts of the academia, from the government, so as to build upon the system resilience part, because this is the time where we need to work on together to improve, and to improve the system first, for second, for system preparedness for any other upcoming natural disaster, and third, the most importantly, for reaching out to the masses. So through this forum, further down, trickling down, we can reach out to a large number of people who would actually be the first line beneficiaries, the second line beneficiaries, and the tertiary beneficiaries, as per the government of India norms. So that vaccine is provided to everyone and everybody takes that vaccine is being provided. That is one thing, but everybody seeking the vaccine would be another thing. So demand generation, improving the demand generation of vaccine system, the vaccine acceptance, is a major challenge, which I believe that through Sphere India's workshops would be a very positive, would play a very positive and a very important role. So thank you once again, and this is all from my side. Thank you.
Thank you so much, Dr. Ashish, for highlighting and specifically flagging the misinformation part, which needs to be certainly focused and addressed by proper dissemination of news and no proper dissemination of IEC material also in the community, since this is a new vaccine and many people are not aware about its implications, about its side effects, about what would it entail, or it's also heartening to see that the government of Manipur and some other northeastern states are proactively working towards curbing this misinformation. And you've also highlighted that how these awareness campaigns and adopting a multi-pronged strategy, a multitudinal strategy, needs to be employed at various levels, in terms of the routine immunization in Manipur. It is quite alarming to know that otherwise also the routine immunization in the state of Manipur has specifically for children has been low. And with this pandemic, I think there will be still some work to do on how to motivate these people for the vaccination. So very rightly said that we should not lose our focus on other routine vaccinations while this pandemic thing is also going on. So the continuity of the other services also plays a very pivotal role, and we look forward to working very no, closely with WHO and UNICEF in different states. As you rightly pointed out, that we are a collective forum and we work very closely with the grassroots, with the peripheries on disseminating the right kind of information. So let us try to plan out and put it and factor it in our subsequent academy sessions on how to devise no contextualized no risk communication or community engagement packages. I see that the government of India is already working on such packages right now. It's still in the finalization, and how does it go to the grassroots organizations or the frontliners is something that we have to take up in our subsequent COVID Academy sessions. Thank you so much for a very useful session, sir. Thank you. Over to you, Chanthoy. Shantanu, are you there?
Hello, hello. Am I audible?
Yes, Shantanu, you're audible now.
Okay, I'm so sorry. It's because of some technical problem. Okay, I would like to next. I would like to request Dr. White Premchandra, who is Deputy Director of Public Health Services of Manipur, to take the next session. And in the meantime, I would like to inform that Dr. Uthan is very much confined with some emergency work in the hospital, so he might be joining. Or if he cannot join, then the next session will be taken by Father Bizu. So I would like to inform Father Bizu for the next, I mean, after the Dr. Prem Chandra's session.
Good afternoon, everybody. Is my sound audible?
Yes, yes, sir, you are audible.
So, thank you, Inspire India, and for this opportunity to be a part of this COVID Academy. And I'm thankful to the sponsors, to the collaborators, and to all other organizations who have been able to bring out this virtual training platform for COVID. And from our health directorate side, we are ready to extend possible support and, and help towards the training of the different NGOs, community organizations, faith organizations, religious organizations who are taking a major role in containment of this COVID pandemic. And from the Directorate Health Services, I would like to extend a warm welcome to all the participants who are here today, all the NGOs who have been working day and night in bringing up the healthcare system of the state. We have we understand that there are many areas where the government is failing to reach. Say not only about this COVID, like when you talk about healthcare of the maternal and child health, family planning, or HIV or TB, most of these health facilities are available in the urban areas in city, but in the far-flung areas, these are being looked after by the most of the NGOs, and they are filling the gaps and they are bringing out the health status of the state. And it's the right time here that we are lucky that Government of India has initiated such program of collaborating with all the NGOs of the working in the country, and in our state also it's been happening. And the first task is empowerment and right education. So this step of taking off education, the NGOs and also the frontline workers who are spearheading the movement is the right step ahead. Of course, in our state of Manipur, though Spear Academy training has been planned quite a few months back, we're a little late, but nevertheless, it's the right time now because as our previous speaker have mentioned that now we are moving towards vaccination. So there are a lot of issues which may come up during vaccination. So this is a time where we need to spread the right message, the right information, and also to make people aware the importance of continuing still the infection control measures, the times of vaccination also. There may be stigma, there may be other issues. So we need to know the mild cases, what it mean by mild cases, or what it mean by moderate cases of COVID-19, what are the different infection control measures. And this training will be an ongoing process. And I believe that there are schedules coming up and will be able to extend more and more um, awareness to all the frontline workers and to the non-medicals also especially because only the medical or only those persons who are working in the health directorate will not be able to control such a pandemic. We need to empower the public. We need to empower the local clubs. Of course, this has been undergoing for the last few months since March. We have been struggling, and we are lucky that Manipur, though a small state, though we're having a diverse population, though we're having a diverse community, we could bring out together, and we have been fighting collectively. We all understand that in Manipur, we have got we have been we have undergone COVID testing for around 4.9 lakh patient. There was around 5 lakh patient, and the positive patients are now 26,693. But because of all our collective efforts, now the active case has been reduced to hardly 477. This is below 500. So we are having a good recovery rate, though unluckily we are having a reported death of 365. So we want now not to increase the number of positive tests and to make the patient recover soon so that people come out. If there's any suspected symptoms, they go for testing, they go detected early, and they get treated so as to reduce the death rate. And we also now understand that most of the deaths of COVID are happening to those patients with diabetic heart disease and hypertension. So it's the right forum now to say this message that those patients who are diabetic, who are hypertension, who are having heart disease should go for their regular health checkup because there are stigma and there are misconceptions that people, if they go to hospital, they get infected. So we find that many patients are not getting checkup or getting treated. And on the other side, we also found that there are again excessive fear among the healthcare workers, and there are areas where the OPDs are not available. The governments are trying hard to open the regular OPD, and most of the hospitals now have started opening the OPD. And now is the right time for all the NGOs to come together to help the health system to come into their earlier normal states so that all the people who are elderly, who are sick, will report to the hospital and attend their regular health checkup. Because if we don't care the regular health cares, then we'll fall in the prey of the COVID. So we should all understand that this information needs to be spread to all our public people and all the volunteer organizations that while caring for COVID, we should never forget about the non-COVID cases because the mortality of COVID is with the COVID comorbidities. So I wish this forum, the COVID Spear Academy, a good success. And we believe that in this vaccination era also about we need to educate our people, we need to spread the right knowledge, we need to clear the misconceptions, we need to clear the doubts and myths, and we need to strengthen our force. So there should be a good communication between the government and non-governmental organizations. Only when there is a health activist, we should say in Manipur or in India as such, we don't have a good health activist. Though we have many other activities like human rights activists, then environmental activists, we found very less health activists, maybe because time may not have been available empower our staffs by proper training. Thank you all and wish all grand success. Thank you.
Thank you very much, Dr. Premchandra Singh, for the valuable highlights of Manipur, especially, and thank you very much for encouraging. I mean, to encouraging the NGOs to work together in the health department to bring up good health in especially in Manipur. We all know that in Manipur we have been lacking so many other diseases. Because of so many other diseases, we had many death during this COVID, and that was importantly highlighted by Dr. Prem Chandra. Thank you very much. And we next, I would like to request Reverend Father Biju Lucas, who is the director of DSS Infal and also a convener of AIZ Manipur. Welcome, Father, and you can start the session, Father.
So thank you for giving me this opportunity to speak my experience during this COVID-19 2020. The offset, I want to thank all the organizers and the resource persons for giving this valuable topics and valuable points regarding this coronavirus and its vaccination. And let me go through the struggles what we have gone through in the last year and which way we come into the present new year 2021. In the year 2020 marked with the COVID-19 pandemic with a great panic in our state Manipur. COVID-19 was a mega pandemic if ever there was one. No other outbreak, even it was called a pandemic, affected people in as many countries as this one has. Nothing has ever caused the world shutdown. Every country that has tried to follow a different path, calibrate or otherwise, has discovered that a shutdown is inevitable. The year 2021, we began with a dry run coronavirus vaccination. In the in the first case of coronavirus was reported in Manipur on 24th March 2020. That was a red letter day in the history of Manipur. People were in fear psychosis. By afternoon, people blocked all the byways and laneways which were leading from the highways. The vehicular movements and the people movement stand still. The villagers started to block their every entry into the village when migrants started coming from other parts of India and abroad. They made the gates kilometers away from their village and kept vigilance guard at the gate. In the month of May, the returnees started to come in and the cases were all increasing in Manipur. The government, CSOs, NGOs, and the village authorities handled the situation with great and utmost care and seriousness. A big salute to the state administration and frontline workers, volunteers, doctors, and nurses. The people in the villages face great problems economically, socially, psychologically, and spiritually. People could not go out and go in from the villages. In the beginning, they could not even go to their field for work or harvest their produce. There were no marketing facilities to sell and buy the essential daily commodities. They had to keep social distancing, educational institutions were closed, and no spiritual or ritual animations and place of worship remained closed. It was like a warlike situation because of the fear psychosis. The state government, CSOs, and NGOs started making arrangements to reach out to the people with the relief services. They were done a commendable. They have done a commendable job to keep the people intact to prevent the community in the spread of coronavirus. DSSS started relief service from 8th of April 2020 to 3,242 families, 52 villages in 10 districts of Manipur. DSSS went forward with the instruction of the state administration, district administration, village authorities, women organization, and the youth. They all welcomed us with open mind and heart. We kept the SOP, social distance, and took some time to instruct the people how to prevent and control the spread of coronavirus in the interior villages. They were given masks, sanitizers, and food provisions. It was a great relief for the people when the returnees coming to the state with a great number. The Directorate of Health required many more places for isolation and quarantine. So we have given so many schools and hostels for institutional quarantine centers, and our hospital for isolation. As to the intervention made by DSSS, the government of Manipur recognized the service of DSSS and recognized its effort to help out the people in need and fight against COVID-19. DSSS was thus designated as the nodal or mother NGO for Imphal East District of Manipur by the Deputy Commissioner of Imphal East on 24th April 2020. Now in Manipur, number of positive cases are 28,693. Recovered is 27,851. Active cases are 451. Recovery rate is 97%. And total death in the state is 365. Last 24 hours, there was no report of death. 26 active cases were new cases were there, and 46 discharged. Some nurses and doctors were not allowed to come to their home or village back after their duty in their own places because of the fear of the spread of corona in their villages. Schools have the online classes. People came back and started to take up cultivation and farming. Those people who returned from other places, they are in the village and they have posed to take up their kitchen garden and cultivation as for their livelihood. We need to conscientize the people and prepare the people to live with this corona in a new way. Hence, Spear India and IAG have started this launch of COVID Academy in Manipur, would bring many people awareness and concentration on this spread of COVID coronavirus. I take this opportunity to thank all the IAG members of Manipur for participating, and I wish all the resource persons and all the people benefit out of this launch of COVID Academy Manipur. and let this academy live long, and it should bring benefit to the ordinary poor people in the urban and remote areas. So I wish IAG and Spear India all the best and God's blessings from the Almighty. Have a very pleasant time, and thank you all for all the listeners, and let us go forward with courage. Let's go forward with strength, and may God bless you all. Thank you.
Thank you very much, Father Viju, for the valuable suggestions, and thank you very much for your support to bring out this COVID-19 Academy launch. And I hope we will continue to get support from your side also. And the next, I would like to request uh, Kesam Tamo Pradeep Kumar, who is a secretary of Social Elephant Association, and also who has been work as a former member in the Manipur Commission for Protection of Child Rights. So Tamo, I would like to welcome you
Mm.
on the session.
Thank you very much. Uh, just listening all the deliberation till now, I'm just wondering what is my footing here in this very nice conversation. But as a child rights practitioner, having certain years experience, I have noted a very valuable statement given by Dr. Assis of perhaps from UNICEF, that our mission for combating COVID or this coronavirus cannot be go along, not focusing alone to this COVID pandemic, but we have to take care all others, these possibilities of impacting children. Most I'm talking about children because he has also mentioned that immunization cannot be neglected, and it should go along with giving vaccination of the COVID-19. This very, uh, very important area where my stack is also on the same line. So just bringing certain facts around rural and urban areas of Manipur, I just like to mention that during this pandemic hit period, uh, many children have been affected in various ways. Not only uh, certain, very few of children have lost their lives, and in the world scenario also, fatality rate of children compared with adults, children are in the very low percentage. But we cannot deny the fact that there is long time and a lifelong effect of the pandemic to the very life of every child. Suppose we miss routine vaccination today, and even you give this vaccination for COVID, but we cannot rule out any other infection in future. And fatality rate of children below 5 will be increased very, very highly. It has been already predicted by UNICEF also. And coming in the coming 12 months, we will see millions of children dying because of certain malnutrition, maybe because of not getting timely vaccination to prevent from tuberculosis or other diseases. So I just like to give emphasis on the need of an inclusive strategy where vaccination for COVID is uh, given, and also other routine immunization is carried out hand by hand. We have certain reports of dying of pregnant mother along with the unborn baby because of not getting admitted to certain hospital in Manipur, in private and in government hospital. That is very unfortunate one. and that might be because of the panic level that was fashion in that period of time. Now the panic level has been decreased, but still people in generally from rural areas are not accessing to the public health facilities. There are many barriers, because it may be because of the you need to have mandatory testing of this COVID, and also there are lack of support system and friendly service system in that particular public hospital. And in case of private hospital, you have to pay very exorbitant fees, which normal people cannot afford. And on the other hand, Manipur, which have a good record of maintaining IMR of a low percentage of IMR. Now there is a high chance of increasing of the IMR. I mean the infant mortality rate, because we have been missing routine immunization, BCG, etc., etc. Because in the last 11 or 12 months, uh, people were very much fearing to go to public hospital and get immunized themselves. So how can we recoup this immense gap of immunization that has to be looked after? And the chances of mortality of the pregnant women, also very high, because people cannot go to private hospital and they are compelled to give delivery in their localities at home instead of institutional delivery. So these things has to be looked upon. And another very grave concern area is about the mental health situation triggered by this pandemic. I have accessed certain information from mental health practitioner in state level and a certain NGOs who are giving voluntary telecounseling services, and they have informed me that people there are around 40,000 plus people returned from other parts of India to Manipur during the COVID pandemic period, and many of them, adolescent young ones, are having certain one or another problem of trauma, emotional upset, and many things. And we have also seen that one girl committed suicide, though she was already recovering. She recovered from the COVID positive, but because of certain circumstances, she committed suicide. That is the reported one. We have to see, is there any unreported cases of this kind of things, and also see people, those children, adolescent boys and girls who are getting certain traumatic uh, impact of this pandemic. We have seen another generation of addiction to smartphones, because in the last certain months it has been mandatory for students to use their mobile phone access I mean from it is longer time they have to give time to these stuff smartphones compare with other normal time. So there was cases of misuse of mobile phone also, and exposing to this Android phone, they may be getting certain abusing of the this mobile phone, and also cybercrime. Certain cases of cybercrime also been reported. So, in short, I'm not a health specialist. I'm not a health worker, but I'm just saying that we are must focusing on saving the life. Number one, that is very much important. There is no denying. But if we could uh, s- save certain lives, the life should be with quality life. Mere, I mean, survival is not adequate for every life. So when a person is not having emotional balance, or if she is already having certain other diseases, not necessarily this COVID, then we cannot claim he is having a very nice and quality life. So we have to see how can we make sure that every child, every person is not having other issues because of focusing only to COVID and the vaccination, and neglecting other areas, especially emotional and the mental health areas. So how can we resolve? See, many people are not having that kind of rationality to go to to one psychiatrist, one psychologist or counselor, that I'm having certain emotional or psychological issue. But after facing this impact of COVID-19, it has been very much increased. The number of person affected by mental health issues is very much increased. So though they are not having that rationality to go for voluntarily to one who can help them. So how can we bridge up this gap? This has to be strategize. And when we in this COVID Academy Manipur is planning something, we must give emphasis on how can we include this area of mental health issues amongst the students, among the uh, growing of children. And also we are about to face another immediate challenge, that children are about to attend school again now, because the educational institutions are about to reopen. So how can we make them very self-confident, and also having uh, equipments, life skills, education with them? So in this society, giving life skill education is not it is not done by the formal institutions. So the need for intervention for from NGO sectors and other international agencies for giving life skill education, reorienting themselves, adapting to the new normal situation is very much required. And I'm very welcoming all these efforts for giving to all the people of these vaccination facilities. But no, only this vaccination for COVID is not adequate, I think. So uh, with this word, I would like to suggest that please incorporate other NGOs working in the field, especially people who are working for the rights of children and girls' education. There are a lot of drop of children, and there will be increasing also. And there are cases of very high cases of child marriage during this pandemic period. From March to January, you have got alarming number of increasing number of child marriages. It may be because that they have been concentrated only through certain phones, and not having any socialization process, and they were thinking for some negative response. They wanted to adapt with certain possible ways, then they choose to get elopement. This may be a certain reason for increasing number of child marriages, and other cases of elopement, and also trafficking cases also in a very alarming one. It is one of the social impact of the pandemic all over the world, and the Manipur is not an exception. So I just like to request to give emphasis uh, uh, to be attentive on certain social issues, mental health issues, educational drawback issues, while taking up this kind of massive uh, strategy for reaching out to all the people, and giving vaccination to save the lives of precious lives of all people of uh, India, and also Manipur. Uh, Thank you once again. Thank you.
Thank you very much, Tamo Pradeep Kumar, for very, very important areas which Tamo had highlighted. Uh, Especially how the this because of this COVID, how many people, especially the young children, how they were affected psychologically, and even we find suicide case in Manipur because of this psycho attack, even after the recovery of COVID-19. And also many young children who were forced or compelled to use smartphones, and which cause many negative impact of misuse the gadgets, and which lead to other unwanted areas like eloping, like child marriage. So these are the very important issues which we need to take over, and which we need to work on this with the working of this COVID-19 vaccination, and to overcome this disease, this very disaster kind of disease. And also, we need to focus on adequate steps for children to get back to normalcy life. This is very important because for about 1 year, children have been stopped going to school, and their practices has already been diverted from the normal life. So these are the very important areas which Tamo highlighted, and we also think that this is very important areas that we which we need to work together side by side with the health issues, with the health problem. So thank you very much, Tamo, and hope I mean your voice, your these messages will reach to our higher authority, and we can get some adequate steps to work together. Thank you very much. And next I would like to request Hena, Dr. Hena Hizazi from Sphere India, who is a senior manager, to give uh, her session.
Thank you so much, Antoy. Am I audible?
Yes, yes, you are audible.
Uh, I think largely we have covered some very essential components of what this launch event is all about,
Yeah,
what we want to achieve through this, what are the issues and concerns vis-a-vis COVID, and with this new COVID vaccine rollout coming into play. So, what is our role? How is the shifting of roles happening, and how prepared are we? So we have taken some vital clues from today's discussion, which will feed in our subsequent COVID Academy sessions, which we will have detailed discussions with Ranjit sir, the Manipur State Disaster Management Authority, as well as the Health Department. Now we have with us. Dr. Gracia and Dr. Tilakeshwari. Dr. Tilakeshwari, I have spoken to many times, and she's always been very supportive, very helpful in extending all help and cooperation in helping us roll out this initiative in the state of Manipur. Now, apart from sir, before proceeding, Mr. Pradeep Kumar, thanks for highlighting some of the aspects of mental health, the impacts of the social impacts of mental health, of COVID on mental health specifically. So, yes, there is a need of building a decentralized, a destigmatized, no, process in which is ingrained in the community itself. So, thanks for highlighting that. We will be happy to have you as one of the hosts for our subsequent academy sessions, in which you can discuss more about it and give more information to these frontline workers in terms of understanding how it has impacted and how we can strategize and address this at the community level. We have to imbibe the lessons of COVID and find various ways to also strengthen the public health infrastructure as well as the allied services. Now, with the phase one over, we are now grappled with new issues and concerns which we now need to factor in our academy sessions. Now, here, Dr. Gracia, and we've other health professionals also joined here. So we are looking forward to your support and cooperation in terms of helping us roll out these set of COVID sessions on, for example, the common questions that are in anybody's mind, especially the frontline workers. How are we ensuring vaccines are safe? How are we going to monitor for COVID vaccine safety when they are given to the community? There are some vaccines using new technologies, so how how can we know whether these are safe? How can the civil society and other stakeholders be engaged in this massive exercise? What should be the role of the CSOs, the frontline workers, in complementing and supplementing the government efforts in terms of no allaying and addressing the misinformation which has been rightly pointed out by some of our speakers today? How do we address the risk communication, the community engagement programs? So that should receive a large amount of focus. Now with Dr. Tilkeshwari and Dr. No, Gracia here, we are also banking on their technical knowledge on imparting such skills to the frontliners, to the outreach workers, the health workers, who will be very much a part of our COVID Academy sessions. Ranjit sir, after this launch event has been formalized, now we are having more of one-to-one discussions with the health department and your department in terms of no, discussing what could be the potential probable topics which we can no, take up during these academy sessions. Subsequently, I mean, we can have 5 or 6 or 7 to start with, and then we can look into what is coming largely in my mind is the dissemination of some of the material that is lying with the Ministry of Health and Family Welfare. Sometimes because of lack of awareness, we are not very aware of that the vaccine does not have any demerits, that what are the advantages of having it, and to also address the hesitancy that is among the communities. So how to address that? So some of our experts from WHO and UNICEF may also be supporting us, but it is largely the health department whom we rely on, who can provide us the requisite support in terms of rolling this. Now, as I told you that there's been some actions in terms of the no, having the role of the CSOs no, into this. This also for the general information that during the phase 1, the overall outreach of the COVID vaccine will target almost 5 crore frontline workers and stockpile reserves, where Serum Institute will also pool in. So the second important aspect is the continued communication material and the strategy ensuring civil society organizations which must advocate for a continued COVID appropriate behavior. Now, instilling that, emphasizing that, reinforcing the COVID appropriate behavior, because now that the vaccine is here, we should not say that we do not have to adopt that. In fact, this is the right time for reinforcing that even more. So, how do we do that through these COVID academies is something that we need to discuss. Our state coordinator, Chanthoi, is very much there and flanked by her no, immediate manager who is joined with us today. Her name is Vandana. She is managing our knowledge and capacity sharing vertical in Spare India and is very much overlooking work and supervising work which is happening in the state of Manipur. So under her supervision and we can have some joint no, discussions with Dr. Tilkeshwari and some of the other doctors who are there in the health department alongside the STMA to work out the no, a schedule, a calendar of some of the trainings that we can roll out, some of the sessions that we can roll out. These will be for 1 hour each, and a certificate of appreciation will be provided to all the participants who will attend these sessions. We may need to review the and contextualize the materials that we are using to Manipur context. So in that regard, we are largely looking at and relying on the technical expertise of the health department of the government of Manipur to come out with more focused, interactive resource material which can go into this. We have a lot of videos at the Ministry of Health and Family Welfare website, which can be disseminated. This academy sessions can also be a medium of dissemination of those videos, which can then go to the peripheral workers, because it is done in very simplified language and which is very easy to understand with some of the guidelines done in very easy language. And then we have a host of flyers, brochures, information material being available with us, which can go and we can have orientations on those IEC materials during these sessions. Having said fact that we are also looking at, as I mentioned earlier during the conversations, that there is a risk communication and community engagement package, training package being prepared right now by WHO UNICEF, which will be no ready in some time for the frontline workers and the CSOs, which will then be rolled out during our subsequent academy sessions. But for now, we would want to hear from Dr. Gracia, Dr. Dilkeshwari in this interactive session on what is their ideas of how we can impart and how soon can we do these academy sessions, and if there are any, we can finalize and crystallize on some dates for these academy sessions since the launch event has already happened. We would like to hear from you, Dr. Gracia, Dr. Tilkeshwari, before we hand it over to Vandana for an open discussion, a question answer session, in which we invite all the other participants also to share their perspective on this academy launch and the subsequent academy sessions. Dr. Gracia, Dr. Tilkeshwari.
Hello.
Yes,
Yes,
ma'am, you are
ma'am.
Hello.
audible.
Audible.
Yeah. Am I audible?
Yes, you are audible, ma'am.
Okay. Thank you very much for for allowing us to participate in this group. I'm really thankful, and our health director also very thankful to the organizer. And regarding this training, I think for vaccination program, Manipur government have already started on the line of the training regarding to the health worker and other organization like a volunteer organization and all. We have not started from the health services. So for any thing, we'll talk together and then we can uh, start the session. So over to Gracia.
Hello.
Yes, you are audible, Dr.
Um, Actually, Ma'am, the Tilakeshwari is the in charge for the state COVID training and guidelines for Manipur. So I'm working under her, and we have already trained all the healthcare workers from the state level. But from the vaccination, for the vaccination point of view, we have not started training. But then, if we get the training modules, because the training modules that was given before, there are some topics regarding vaccination, but I'm not sure if the vaccination modules is covered like up to date. So we would try to collect more training modules, and then maybe we can start the training by maybe after 2 weeks, or yeah, in and around 2 weeks. I think it's okay.
So thank you, Dr. Gracia and Dr. Tilkeshwari. There are a host of information material that is already out, which the Government of India and the Health Department is no, encouraging people to no, widely disseminate, share, inform. I was a part of a Government of India meeting just 3 or 4 days back, wherein they are emphasizing on sensitizing and putting a lot of awareness to the CSOs, to the frontliners who are working in the peripheries, particularly the PRI members, the faith based leaders who have a say in their community. Now, Father Biju is also here with us. I know that he'll also agree that these faith healers have a very prominent place, and the community usually rely on the information that they provide to their respective communities. So, yes, very rightly said that the modules are still in the offing and in the pipeline. But in case we can make available some information material on COVID appropriate behavior, maintaining that in this COVID vaccine time, some material on the COVID vaccine, would you be able to roll out at least a couple of sessions in the coming week or subsequently after 2 weeks in the course of time? Because we're largely looking and banking on your expertise, because you're trainers, you professional trainers, so you're the ones who are going to spearhead this and take it forward. Dr. Tilkeshwari?
Yeah, we can do that in 2 weeks. We can do that, but we would need a schedule that how many modules are we going to prepare, and how
Certainly,
many uh,
certainly
and how
that
many
will be
days
made
how
available.
many days
Yes.
we are, yeah,
So
because we
are
want to
we
pre-plan a little bit like in advance, because
beforehand? Yeah.
before.
Well ahead, well ahead. So Chanthoi, who's our state person focal point there, she will get in touch with your department, and based on your availability, feasibility, we can freeze some dates. And based on the feasibility of some of our resource person, maybe we call some people from interstate who are well versed in this from the health department only. So, but then there can be a cross learning and a cross sharing of experience also. We can also work out around that. We will let you know. Chanthai will prepare a calendar, and then we can, with Vandana's no permission, we can then she will have a look at it. She'll review it, and then we can roll it out in the state of Manipur. At this
Yes,
point,
ma'am.
Vandana,
Mm.
I want you also to come in the conversation, and we can further no take up the question answers also in this open discussion.
Sure, sure.
Yeah,
Yeah,
over to you, Vandana. Yeah.
yeah, yeah. Thank you so much, Hinaji. So, I think we had a very good and rich discussion today. And I think this is the phase now when we have to focus on, again mobilizing people on vaccination of COVID. So I think, as Hinaji has rightly mentioned, so Dr. Tilakeshwari, we will be in touch with you in this regard, that how can we take, up this and, COVID sessions, on the emerging issues to aware the people. And especially the frontline workers. So yeah, certainly I and Chantoy will be in touch with you to, plan the sessions for the state. But besides that, I just have a request to everyone who are there that based on this rich discussion we have had, uh, do we have any other questions or queries which we can clarify at this point of time? So over to
Albert has
everyone
raised his
whosoever
hand.
is. Yeah. Hello. Can you can you hear me?
Yes, Vandana, we can hear you. Albert has raised the
Yeah.
hand,
Yeah.
and if
Yeah.
yeah, if we can hear you, Albert. Probably some audio issues. Ranjit sir, do you want to get here in this at this point of time for any
Hello,
closing? Yeah, yeah.
hello.
Yeah. We
Can
can
you hear
hear
me now?
you. Yeah. Yeah.
Yes,
We
yes,
can
yes.
hear you.
I'm joyfully listening. Hello.
Yes,
Yes,
Albert, go on.
I'm listening. I'm a starter only. I have to listen to other participants only.
Okay, okay, Albert.
Okay. Yeah.
So, Ranjit sir,
And when it comes to note making, the molding, I'm incubating one nose pad. That's all.
okay.
I'm saying in COVID related prevention tools, I'm designing one nose pad.
Sorry, can Chanthui you spell it out for us? I am not able to. Yeah,
I
Yeah.
think it is a mask,
The
maybe
I
mask.
did. Okay,
I
masks,
guess
masks. Okay,
for mask,
okay,
I'm calling nose pad.
nose
okay,
pad.
Uh,
Nose pad. Okay.
okay.
Nose pad, that is a
Nose
mask.
pad, mouth packet.
Oh, that's a wonderful
Okay.
concept. Yeah.
What you want to say, Albert? I mean, what you want to
Yes.
ask, or you have any questions?
A large scale, in terms of COVID spreads, and also the vaccination whatever it may be, we need a large scale awareness programs
Yeah, yeah, yes.
because awareness has been created in Impal area only.
Mm-hmm.
And even in Impal area, the periphery of Impal, suburb areas is not properly covered, I think. And moreover, rural area is nil.
Okay.
And they find it difficult to wear nose mask.
Mm-hmm.
And we need to change the nose mask into some kind of a pad, which is easy to wear, convenient to wear, and easy
Mm-hmm.
to breathe. And that's one. But overall is that in rural area, awareness has to be raised at a high level.
Okay,
Thank you.
okay. Okay, okay. Thank you.
Thank you so much, Albert. A very
Thank
valid
you.
suggestion. We have
Yes,
taken
yes,
note of your suggestion.
yes, yes.
So, any other question for any participant? Or else we will invite Dr. Ranjit to give the
Please invite,
closing
because right
remark.
now I don't have any more questions.
Okay.
Thank you,
Yeah.
thank you. Welcome.
So, sir, you can mute your mic
Yes, yes.
and video.
Sir Albert, video the off the bureau. Video the off the bureau. Start video the stop the bureau.
So, Ranjit sir, you want to come in with any closing remarks?
Madam, am I audible?
Yes,
Yes,
sir,
sir,
you
loud
are.
and clear.
No comment. It is a wonderful conference, and for the remaining other program, let us go ahead.
We look forward to your kind cooperation and support in our endeavor to roll out this, because all our deliberations which will happen with the health department will route through your department also. And thank you so very much for extending all your help and no extending all your cooperation for making this happen and making this launch event happen. We are equally thankful to the health department for their no continuous support and cooperation. And let us not forget Chanthui, who has coordinated all of this. Chanthui, a really a good word of appreciation for you for making this happen. Thank you so much for coordinating all of this. Thank you, Vandana, for overlooking and supervising the work and no, being there in the preparedness side of it. And some of our other colleagues who are here in the platform, managing the platform, we have Shantam with us. Thank you so much, Shantam. And to all the participants who have joined us, thank you so very much for your patient hearing and for your patient listening. We hope you pass on this word to your respective community members in terms of these COVID Academy sessions that we're going to have, so that we have maximum coverage. And we are also looking forward to the State Department mobilizing these PRIs, these health workers, these volunteers at the district levels for ensuring maximum coverage of the people and participants in our academy sessions, which will be on the virtual platform for 1.5 hour. 1 hour will be for the technical session and half an hour for a question answer deliberations. Are there any other questions from the technical team, the speakers, which they want to ask us before we close?
Yes, Sir Korji. Yes, Hasran Korji.
Yes, ma'am. Thank you so much for this wonderful session. We have learned a lot, and I look forward for the other sessions to attend with you. Thank you so much. Thank you. Thank you, Sphere India.
Thank you,
So,
Ms. Kaur. Thank you, Ms. Kaur.
thank you.
And Chanthu, if you can give a word of thanks.
Yeah. Uh, Actually, everything has already said by Dr. Hena. But overall, I would like to thank each and every speakers, starting from Professor Santos, who is not with us now, who has already leave for spending for giving valuable time, in spite of his very much busy schedule. Then Dr. I would like to thank Dr. Asis Dawud also, who is an health specialist, Northeast States, UNICEF. In a very, at 11 hour, he accepted to, I mean, actually he replacing one of our previous speaker who was supposed to be with us. We are very much thankful to him also. Then Dr. Premchand Singh, Deputy Director from Public Health Services of Manipur, who will be also our trainer in the coming sessions. Thank you very much, Dr. Premchand Singh, for your presence. And I would like to thank Tamo Pradeep Kumar, who is very much working for the social upliftment of Manipur and especially with the child protection area, and who is also very much concerned about the children and especially young children and girls of Manipur, who is being endlessly and tirelessly working. And I would like to thank Dr. Hena, who is our senior manager, who is supporting us, who is guiding us from very small step to bring out this session, and Vandana ji, who is our manager, who has been guiding us from the very small things. And I would like to thank my colleague Rachel from Nagaland, who is just like my mentor for this Zoom session. As for me, is new to organize a Zoom session, so she is day and night helping out. So I really like to thank Rachel for your support, and I hope I'll get more support and go together to work for Spare India. And I would like to thank all the participants from whoever is joining here for making this session work out. And I hope to see together more. And I would like to thank Dr. Tilakeshwari and Dr. Gracia also for supporting me. Dr. Tilakeshwari is very much proactive in supporting to make the things happen. And Sir Ranjit from Disaster Management Department, who is very much, when they have very limited staffs and when they have already confined with so many state work, then but still he is giving his time to make these things happen. And I hope more the long coordination and support from disaster management and Sir Ranjit. One and all, everyone, once again, thank you very much for making this event successful.
Thank you.
Welcome, Hena.
Thank you, everybody. Thank you. With this, we close the event today. Thank you so much. We hope to stay in touch. Thank you.
Okay, thank you.
Thank you.
So
Thank
thank
you.
you, one and all.
Thank